It's a pleasure to give this overview over our ReLapsE trial, phase 3 trial, on behalf of our study group, the German Myeloma Multicenter Group, or GMMG. So the ReLapsE trial really is the first trial of a salvage autologous transplant for relapsed multiple myeloma compared to a standard arm with a continuous novel agent-based therapy. So the ReLapsE trial ran at 16 trial sites all over Germany, and we recruited 282 patients that were randomized to one of two trial arms, one control arm which consisted of continuous Lendex at standard dose until progression, and then an experimental arm which started with a Lendex reinduction of 3 cycles, then had the high-dose chemotherapy and stem cell transplantation step, and then continued with Len maintenance at a dose of 10 milligram daily until progression again. So patients were included based on key inclusion criteria of first to third relapse, of an age up to 75 years, and then of course transplant eligibility. So at data cutoff at 2017, we had a median follow-up of 36 months, and surprisingly at this time point, PFS and overall survival were not significantly different between trial arms. There were some limitations in interpretation of this finding. Specifically, this was an elevated fraction of patients in the transplant arm with high-risk cytogenetics, and then also a substantial fraction of patients in the transplant arm that did not actually receive the transplant. So, and then this fraction amounted to 30% actually. So the question at this point was, what would the treatment effect be in the patients that actually did receive the salvage transplant? And to answer this, we performed landmark analyses from the time point of the transplant in the transplant arm and the corresponding time point in the control arm, which was the 5th cycle of RD. And these landmark analyses then showed us superior overall survival and also a trend towards improved progression-free survival in the patients receiving the transplant. And if we looked at this multivariately, including established risk factors such as high-risk cytogenetics, then we saw a significant association of the transplant with both improved PFS as well as improved overall survival. So then the other side, of course, is safety. Looking at toxicities, we saw that the overall rate of higher grade toxicities was comparable between arms. On top of this, we saw increased hematological and also increased gastrointestinal toxicity in the transplant arm, which is considered related to the high-dose chemotherapy and is considered expected in this setting. So the most important point regarding safety was that we did not have any deaths during the high-dose phase, which is, I think, important to note in view of the upper age limit of 75 years in this trial. So concluding from the trial, we can say that salvage transplantation for relapsed multiple myeloma is safe. The treatment effect was lower than we had expected, but nevertheless the patients that underwent the transplant seemed to benefit. And we performed some additional analyses, subgroup analyses, that were presented in a separate talk here at ASH. And what these analyses showed us was that patients with standard risk myeloma or low risk myeloma, according to the revised international staging system, as well as the individual components of the RISS, cytogenetics and LDH, patients with low risk, according to these categories, they had a more pronounced benefit than the total cohort, and actually had excellent overall survival in the transplant arm. On the contrary, patients with high-risk features in these categories, these high-risk features had a deleterious impact on the treatment effect. So there was really no benefit for these high-risk patients for the transplant arm.